Ambassador Sunjay Sudhir, thank you so much for joining us from Male. Could you give us an idea of the situation in terms of there is a lot of pressure on the government, there are a lot of worries. The first death has been reported, even though she was an old lady, 83 years old, and had other illnesses as well. What really is the situation on the ground, sir?
No, I think, first of all, I must tell you that the government of Maldives was able to control the spread of COVID-19 in a very remarkable way. When they were able to protect Male, the capital, till 15th of last month. That was when the first case happened in Male. But considering the fact that Male is one of the most congested cities anywhere in the world, once the first case happened, then contagion set in, and then the spread was quite rapid. But still, I would say that the government is trying its level best. They immediately enforced a lockdown till yesterday, and then yesterday they passed another order that the lockdown will be extended by another 2 weeks. So as of last night, the total positive cases was 468. And as you might have seen that initially the first 20 odd cases were just foreigners. And then there were 4 or 5 Maldivians who had returned from overseas. But so till then, it was all very much under control. And then one odd case hit Male. And that's how it all started. And till last night, there were 468 positive cases, of which I must say that majority of the cases were expats. And the largest expat community which has been hit is the Bangladeshi community. Of Indians, 50 plus Indians have also tested positive. But the government is doing its level best. They've set up this organization called the Health Protection Agency, which is doing a great job. The MNDF, the Ministry of Health, the Maldivian Police Service, the National Disaster Management Authority, they're all working in tandem and all under the leadership of President Soli, who's personally spearheading this whole mission to combat COVID-19.
Ambassador, if you could explain the challenges that the government is facing. You're mentioning the various agencies from the presidency down onwards. 1,200 islands, which are so widespread. But again, when you look at Male, as you're pointing out, one of the most densely populated areas in the world, 400,000 is possibly the total population in Maldives, maybe around 120, 150,000 in Male. The challenges that this government faces, Ambassador.
I think the whole world is facing unprecedented challenges. Never in history have we seen something like COVID. So it's testing all of us. It's testing India. It's testing the West. It's testing Maldives as well. But Maldives, due to the nature of its geography, its economy, its demography, has some peculiar challenges. Of course, one advantage is that the scattered, as you said, 1,200 islands are themselves, geared for self-isolation. So that in a sense works to the country's advantage. But at the same time, to reach out to people, to extend health services, health support services, is a big challenge, because there are some islands which have less than 500 people. There are islands which are much bigger than that. And the total expanse, if you see, of the country is about 800 kilometers from north to south. So the country has a EEZ of about 1 lakh square kilometers. So it's a big challenge in that sense. Male, as you rightly mentioned, Male is a very congested place. So once contagion sets in, then Male is just the right kind of place where things can spiral out of control. And as I mentioned, that the first case in Male happened only on 15th April. Till 15th April, the government was able to completely isolate Male because of a lot of measures which they had taken, including banning island-to-island mobility, including banning, cancelling of all visas. So those things eventually helped. The other challenge is that there's a very high exposure to foreigners. So the first case, the case 0, was an Italian. If you recall our own experience in India, there was this bunch of Italians in Delhi, in and around Delhi, and that's how it all started in North India. Now, That is a big challenge, which they can't wish away, because tourism is the backbone of the economy. And last year, about 1.7 million tourists visited this country, as compared to a population, as you said, about 4 lakh people. So that's a challenge. Also, it has been a challenge for the economy. ADB has recently said that in South Asia, Maldives will be perhaps the worst hit economy. Tourism here contributes about 80% to the GDP. And last year, everything was going very well. The tourist increase was very encouraging. Indian tourist arrival increased by about 90% last year.
To the second highest, like it jumped from seventh, I think.
Yeah, from number 5, we were straight catapulted to number 2. But now, sadly, resorts have shut down, which means that there is this liquidity crisis, there is a shortfall in revenues, and the anticipation is that there'll be a revenue shortfall of about $750 million to about $1 billion. Markets in Europe and Japan are also hit, which means that their major export in terms of commodity export, which was fish, that has also taken a big hit. So the services sector has taken a hit. The export sector, commodity export sector, has taken a hit. So it's something like going back to 2004 tsunami, the kind of widespread economic challenges which came out of tsunami have come back in perhaps a bigger way. So I think largely these are the challenges. Government is gearing up to meet these challenges. Government is trying to do its best as much as any government of the day can.
When you're talking about those challenges, and you're mentioning, say, the budget deficit, and I think the minister has gone on record to give various scenarios, and the most likely scenario, you were giving the figure in dollars. I think he was mentioning maybe 13 billion rupiah, which is almost double of what they had planned. Now, one key mode of assistance that India has provided here in that context, in the neighborhood first policy, is the currency swap, which has been activated, which is part of that 1.4 billion, which was agreed when President Soli came on his first state visit. That's crucial to keep the currency stable and for immediate liquidity requirements, right?
Absolutely. That's one of the most important pillars of support. In fact, that is the first major pillar of support which the government of Maldives has resorted to. I mean, you rightly mentioned that in December 2018, during the state visit of President Soli, India had announced this $1.4 billion economic assistance package, of which $800 million was for the line of credit, $200 million of treasury bonds and budget support. $400 million clearly was the currency swap. So far, the economy didn't need it. But post-COVID, government of Maldives had requested us for $150 million of currency swap, and I'm happy to share with you that just 2-3 days back, on 27th April, the transaction was done. So that will, considerably ease the liquidity situation to some extent, at least for the time being.
Are you also looking at extending it for a year, possibly?
Well, certainly, if there is a request, we could consider extending the swap agreement by a year. But we'll come to that when the request comes. And this is about $150 million has been already utilized. There still are $250 million left in the currency swap arrangement, which government can use anytime.
And it's been multifaceted, the assistance that India has been providing. Just looking at it, we looked at the swap, look at the essential commodities, because, I mean, being an island archipelago, so to speak, with those 1,200 islands, everything would come in, or most of it would come from outside. So whether it's essential commodities, whether it's even things like rice, sugar, cement, medicines that have come via sea, they started pretty early in this period from Tuticorin.
Yeah. See, traditionally, as you know, as everyone knows, that India has traditionally been the first responder, whether it was 1988 Coup, or the 2004 tsunami, or the water crisis in 2015.
2014.
Yeah, 2014-15. Now, once again, India has established that whenever there's a crisis, India is the first responder to that crisis. So the difference between India and probably other countries, as far as Maldives is concerned, is that India not only has the willingness to help, but also has the capacity to help. And that makes all the difference, and we have demonstrated that in the past, and we've done that once more in this COVID crisis. In fact, just about a month or so before the COVID crisis, there was this outbreak of measles.
Yeah.
And government of Maldives requested us for vaccines, and we were able to provide
30,000?
30,000 doses of measles vaccine within 72 hours. And that with that, the government was able to nip in the bud outbreak of another big problem. And then then this COVID happened, and we've been working very closely with the government of Maldives from day one, and tried to give it all kinds of support, as you mentioned.
And what's incredible, say, you look at another aspect by air, when the IAF, the Indian Air Force was used, the C-130 was used, within 18 hours of a request, despite the situation at home, which is one, a lockdown. So even if the order had been placed, how do you get them all together? And then to transport all that material so fast and such important material. That was Operation Sanjeevani.
Right. Operation Sanjeevani was a very, a very special kind of an option of an operation, because they had the medicine, ordered the medicines, but scattered over 4 or 5 cities. And during that lockdown period in India, there was no way to aggregate that supply of medicines, other than using one of our Indian Air Force planes. And the moment we got the request, we immediately switched into action. We were able to pick up the medicines from Delhi, from Chennai, Madurai, Mumbai, and it was some kind of a cross-country operation for Indian Air Force. They started sometime around midnight on that night from Delhi, went to all these 4 cities, and then landed in Malé by midday next day. And we were able to deliver about 6.2 tons of essential medicines. And I think in a time like this, this is very important. And I must say that even before that, when they made a request for COVID-related essential medicines, we provided, we gifted to the government of Maldives 5.5 tons of essential medicines, which would take care of 3 months of medical supply. So I think that was very timely and very helpful. On the medical side, we also sent a 14-member medical rapid response team.
That's after it was brought up in the SARC video conference.
No, actually, it was done before.
It was done before that.
Yes, so the SARC video conference of leaders at the initiative of Prime Minister Modi happened on the 15th of March.
Mm-hmm. This was 14th.
So, sorry, no, 15th. The video conference took place on the 14th of March.
But the team had already, you're saying, was already there.
Yeah. Yes. So the team had already come, done its job, had gone back. The other thing which had happened was that even the gifting of 5.5 tons of medicine was also prior to the to the SARC the SARC coordinated video conference among leaders. So with Maldives, we've been doing these things, as and when we have been getting these requests, and as and when in our assessment we feel that yes, assistance is to be provided. We have been doing that. After that, also, after the digital video conference with Prime Minister Modi, we have been facilitating supply of essential commodities, particularly wheat, rice, other things, sugar, and also cement, so that the construction sector, which is another very big industry here, that should, the engines, the economic engine should keep revving. So we ensured that supplies come from Tuticorin port, and that was a very difficult time for India, and it continues to be a difficult time for India. But to liaise with the state government, to liaise with the central government, and to make sure that these things keep happening, we were successful in doing that and do whatever best we could.
Ambassador, you're the points person for what? About 27,000 Indian nationals who are also present in the Maldives. What's the situation there? Because obviously with the air lockdown, even if people want to come back, until that plan, which has already been worked on to get people back, is put into place, you've got various initiatives. You've publicly reached out to them as well. You've got those kitchens for anybody who needs them. The care packages that you are working on for Indian nationals as well. What's the situation vis-a-vis Indians in the Maldives? Because Bangladesh has been badly hit.
Yeah, I think this has been a very difficult time for countries, for governments, and for individuals as well. And if you look at the profile of the Indian community here, there are about 27,000. It's a very special kind of a profile. For instance, majority of the Indian community here works in the resorts, which are scattered across the country. Now, because of the lockdown, because of COVID, the resorts have been shut down. Now, these people have, I wouldn't say they've lost their jobs, but certainly they have been put on compulsory leave. Now, what do? They can't go back to India because there is a lockdown. So we have been working with the government of Maldives, and I must acknowledge that the government of Maldives has been extremely helpful, extremely cooperative for us. And the government had issued instructions to the resorts to take care of the Indian community staff and feed them and continue housing them till the time they have confirmed bookings for India. So they have done that. So that is one part of the Indian community. Then there were some stranded tourists. There were about 11 stranded tourists who were on resorts. Now, in such a situation when resorts are shutting down, what do we do? So again, working with the Maldivian government, we were able to put them on one resort, on one resort which is very close to Malé at very, very concessional rates. And that was all thanks to the government of Maldives, the Ministry of Foreign Affairs, and the Ministry of Tourism. The third category of Indians is the Indians who are working in Mali. So when the COVID crisis hit Mali, they are all affected. So some of them, of course, have lost their jobs in Mali. And as you have already mentioned, that we are trying our best. Those who are unable to even fend for themselves in terms of food, we have started a community kitchen. We have tied up with some restaurants here to prepare some special food packages. Now, food packages alone doesn't help because they have to be delivered. So we have sought volunteers. We have been able to get volunteers who deliver these food packets. So our effort is that nobody should know Indians should go hungry here. And after the Indians started testing positive and being sent to isolation islands, we have been preparing these care packages. See, we can't solve COVID. We can't take care of the symptoms, but we can certainly make somebody's life less uncomfortable. So we have been putting items of essential use, items which can maybe mitigate the pain, the suffering, the difficulties of the COVID positive cases, and we've been supplying them. I feel that in such difficult times, it's very important to reach out to the people and to keep informing them, because people, especially people who are in faraway islands, of course they read papers, and sometimes what they read from the papers also gives rise to worries, right? Sometimes in an unfounded way. Of course, they do get a lot of information from that. But what we have been trying to do is that we have been trying to channelize relevant information, authentic information to them through our own social media platforms, through our website, through our Twitter handle, through Facebook. And I myself recorded some messages for the Indian community to reach out to them. Another thing, I would like to mention to you is that when somebody gets marooned on an island, so if you're in a city like Delhi and a big family, it's a different situation. But the people who are working in the resorts, they're all by themselves. They don't have the comfort of family. And in such times, you realize how important family really is. So life is not difficult. It has a psychological impact on them also. So we got some mails, and we could feel that people are a little disturbed psychologically. So what we did was that we set up some self-help groups. We set up some counseling helplines. So we have advertised the numbers so people can call these lines, discuss their issues, ask for help. So we are trying our best to do whatever we can.
You're being a family away from home, so as to speak, which is what missions of India should be, or missions anywhere. In terms of, we do know there's a huge coordinated plan that is being worked out of when, say, air travel or sea travel of some sort with our armed forces involved, maybe even other merchant vessels, for to bring back Indians from abroad. Now, the focus is at the moment on the Gulf, but you would have informed the Indians there about the situation. Like you're saying, information and trust is so important of of what's happening in terms of when they can come back, if that's allowed.
Surely. So what we are trying to do is trying to keep in as much contact as possible. So the moment, so the day this opportunity to return comes up, we should be well prepared. So we have been trying to get data of all Indians here, their contact numbers, their names, passport numbers, also their domicile. So in case they have to go back to India, which is then the city of convenience for them. So we have been trying to prepare our databases. We have been exchanging this information back with our Ministry of External Affairs, so that whenever there's an opening, we should then not lose any time in making use of that opening.
Just on a separate note, on developments in the Maldives, Ambassador, in the middle of April, or maybe around the 18th, when those reports came out from Mahibadu about those 5 boats that had been set on fire. There have been other incidents before. It's being investigated currently. But what was different about this was that the Islamic State actually, through its channels, its media channels, took responsibility for that. Now, this has been, radicalization has been a worry with Maldives. We've seen those figures of possibly one of the highest per capita fighters being involved, whether it's in Syria, Afghanistan, other areas. That has been a worry, especially for India, with so many uninhabited islands in the Maldives.
Certainly, it has been a worry, and that, as you just mentioned, that the Mahibadu incident was not a normal incident, in the sense there were 7 boats, including a sea ambulance, including a police boat, and very quickly, the ISIS website, they claimed responsibility of it. So the Maldives,
though all the information they gave out was in the public domain, they didn't add anything further, which would seem to suggest that they were really involved. But yeah, of course, they took responsibility, and that's important.
Yeah. So all I would say is that the Maldivian Police Service is certainly investigating the matter, and I think they have not yet completed their investigation. So we are also looking forward to whatever conclusion they arrive at. But to begin with, they termed the incident as arson. And in the meanwhile, they are doing more detailed investigation. But there have been a few more incidents before that and after that, which do cause worry. But government is, in our reckoning, government is making its best efforts to address these issues.
And Ambassador, one last question in terms of what's the status now of the coastal surveillance radar system that India has been set up in terms of completion?
And doing well. I think it should be completed in the next. COVID has really been a setback for a lot of projects. For projects, in fact, the great enthusiasm with which we had taken up for all the projects has got little slowed down by a month or so, but we plan to resume that. But good thing is that the teams from India were already working on CSRS radars, got trapped here, got stranded here. So they continue working. But of course, there is a little delay on that. But I think give it a couple of months, all the 10 radars should be up and running under the CSRS scheme. As you know, Prime Minister Modi and President Soli have already done the formal inauguration in June last year during the state visit of Prime Minister Modi. Now we are just looking forward to an early operationalization of the CSRS.
Ambassador Sunjay Sudhir, thank you so much for joining us. Stay safe. I hope the mission stays safe, and everyone in the Maldives as well.
Thank you very much.